Namaste to all of you. The intention of this video clip is to make sure that more and more Ayurvedic doctors are encouraged and inspired to have a Rasa Shastra based, fast acting, reliable, proven track record and most importantly safe combination of herbs, kind of same way minerals and metals combinations that can be used even in an ICU setup or to bring very quick, reliable, safe results. This is the objective of making this video. And we have with us Dr. Aswath Rao, who needs no introduction for the Ayurvedic community, being the doctor who has implemented Rasa Shastra medicines in ICU in COVID. And we already have you will see in that video description, the link of the webinar that happened in Sitaram Achar Rasayana on 23rd of January. So I will hand over the further details narration to you.
Now coming to the non-gold preparation or rasa preparation, which I would like to include in the list of emergency medicine is Chandrakala Rasa. All these are gold based preparation, but this is a non-gold based preparation which I feel is a must in everyone's emergency kit. The reason being, I would like to share with you some very interesting experiences which everyone have faced, I am sure, and they have got good results also, is in case of epistaxis, in case of old individuals, in case of hypertensive emergency. In some cases, when the BP shoots up or the epistaxis will be uncontrolled. Even after we get down the BP immediately, for the epistaxis to come under control, sometimes it will take some time. And there was one interesting case treated by my father, where even after the patient was discharged back home after giving some emergency treatment in a modern medicine setup, the nasal cavity was packed by ENT postgraduates. But even after going back, it continued bleeding. Next day morning, they visited the hospital. Again, the blood-soaked gauze was removed. Again, packing was done. Again, they had come back home. So this continued for 2 to 3 days. And even obviously, we will be including hemostatic drugs like tranexamic acid, etc. So in spite of them, in spite of these medications, bleeding did not stop, or we were not able to control epistaxis. In such conditions, in this example, my father gave 4 tablets of Chandrakala Rasa at night. After food around maybe 10 o'clock, they approached us, and next day morning, bleeding had stopped. So the patient themselves removed the soaked gauze piece, but there was no fresh bleeding. This is what we observed. This is one very good example, I feel, where Chandrakala Rasa will be of very great use. We would like to share another interesting case with Chandrakala Rasa. There was a case during COVID first wave. Case is recurrent mandibular carcinoma after surgery, chemo, radiation, second recurrence. This was the condition, like it was an ulcerating and fungating mass. We know these ulcerating and fungating mass will have very rich vascularity. So if it starts bleeding, it is very difficult to control with medications. We have to surgically stop at many instances. Similarly, this case was, this patient was taking tranexamic acid, for example meftalspas, and even he was admitted twice or thrice to the hospital, was given IV medications, and they came back to the, they got discharged and came back. In spite of that, bleeding from the tumor was not able to come under control. So in such conditions, they tried to reach out to many physicians, just to their disappointment. No one was ready to admit the patient in the hospital as it was a COVID peak. I got a call to attend it on an emergency basis, and a flight ticket was booked. I reached the place within 6 hours and gave 4 tablets of Chandrakala Rasa at night at around 7 p.m. And next day morning, the bleeding, which was continuous from 10 days, had stopped within a span of 12 hours after starting this Ayurvedic medicine, that is Chandrakala Rasa. And afterwards, I tapered this. I made this just 2 tablets, and I added 2 Pushanagachurna and 2 Stiklon. So in this way, I shifted to other medicines, tapered, and stopped in a span of 2 to 3 days. And even after stopping these medicines, the patient was fine. There was no recurrent episodes of bleeding. This is one very good example where I feel we can have a wider coverage of this medicine. Even in case of menorrhagia, where before planning the surgery, sometimes gynecologist might have advised hysterectomy, but till then, sometimes it is a situation that even till the surgery, we find it difficult to stop the bleeding or menorrhagia. Even in such conditions, I got to know through an experienced Vaidya that this tablet can be used at the dosage of 6 tablets TID, 666, morning, afternoon and night for a span of 2 to 3 days, then we can taper it. Thank you.